is Jessica. I'm going to be your student nurse today, and I'm just going to be performing a physical assessment on you.
Okay.
This is just a head-to-toe assessment. It's going to let me know what's going on with your body.
Okay, great.
Okay. Are you in any pain today?
No, ma'am.
Okay. Do you know where you're at?
Madisonville Community College.
Do you know what today's date is?
It's Friday the 7th.
Do you know who you are?
Rebecca Wheeler,
Do you know your birthday?
2007, March 1st.
Okay. Patient is alert and oriented ×3. And you said you weren't in any pain?
No.
Okay. I'm going to go ahead and get a set of vitals on you. So I'm going to start with your pulse. I'm doing a radial. Okay. Your heart rate was 64 beats per minute. Your radial pulse was a good rhythm. I didn't note any abnormalities. Your respiratory rates were 14. And I'm going to go ahead and move on to your blood pressure. Okay. Okay, this might be a little bit of pressure on you. Okay. At 128 over 88. Sound about normal for you? Okay. I'm going to go ahead and fill all your pulses. Okay.
All right.
So your radio. Okay. 2+. Brachial. 2+. Carotid, 2+. Thank you. Your popliteal, 2+. I'm going to go ahead and throw on some gloves. Now on your pulses, I will be assessing all of these bilaterally.
Okay.
Okay. Popliteal, 2+. Your dorsalis pedis, 2+. While I'm down here, I note that your nail beds look very nice. There's nothing wrong with them. I don't note any lesions. Bottom of your foot appears to be nice and healthy. You been having any problems with it?
Nope.
I don't note any edema. I'm gonna take off my gloves real quick. Don't note any edema in the ankle. Don't note any edema in the legs. Hair distribution is equal. Your legs appear to be symmetric. Don't note any lesions or deformities. I shouldn't have took that glove off.
What was this pulse called again?
Your posterior tibial.
Okay. That's a new one for me.
Okay. Well, it's been here for a long time. I'll show you. What was I doing? Oh, I want to test your range of motion of your foot. So point it up for me. Point it down. Do a circle. Okay. Now I'm going to push against it. Don't let me push you. I'm going to pull against it. Don't let me pull you. Okay. Now same with your leg. I'm going to push against you. Don't let me push you.
Okay.
I'm going to pull against you. Don't let me pull you.
Okay.
Okay. Full range of motion in the ankle, muscle grade of 5, muscle grade of 5 in the leg as well. I'll go ahead and pull your legs down. All right. Let's go ahead and do range of motion and everything. So if you don't mind, just stand up for me. Now I want you to shrug your shoulders. Okay. Cranial nerve 12 is intact, muscle grade of 5 in the shoulders. What I want you to do is raise your arms up. Okay. Put them down. Now all the way up. All the way back. Okay, now just do a little circle for me. A little circle the other way. Pull your arms up like this. Okay, now with your hands, follow mine. Down, up, side to side. 1, 2, 3, 4. Okay, pull against my hands. Now, don't let me push you. Put your arms up like this. Don't let me pull you. Don't let me push you. All right, full range of motion in the shoulders, elbows, and hands, and the wrists. Muscle grade of 5 in the hands, muscle grade of 5 in the arms. Let's go ahead and do range of motion in your legs. What I want you to do is put it up. Sorry. Do a little circle. Okay, put it back down. Now raise it up and kick it. One more time. Now just do a little circle. Okay, and we already tested range of motion in the ankle. Range of motion in the hip and the knee are fully intact. You can go ahead and take a seat for me. I'm going to go ahead and feel your skin on your leg again. I apologize.
Okay.
Okay, it's warm, dry, and intact. It's appropriate color. I'm going to look at your arms. Same up here. It's warm, dry, intact. It's appropriate color. It's nice and pink. I don't note any lesions or deformities. The arms appear to be symmetric. I'm going to go ahead and fill your crop refill if you don't mind.
Sure.
Okay, it's less than 3 seconds, so that's nice circulation for you. Okay, your turgor appears to be indicate that you're well hydrated. I'm going to move on to your head.
Okay.
Since we've already covered most of your leg, I'm going to go ahead and test your reflex on your leg. Okay? Sorry to pull your leg pants up all the time.
That's all right.
Ready?
Mm-hmm.
Okay. The quad reflex is fully intact. Go ahead and pull that down.
All right. I'll do that.
All right.
Thanks.
I'm gonna look at your hair. Your head is normal cephalic. Do you mind tell me no real quick? Okay, now tell me yes. Okay, you have good control of your neck and your head. Your head is normal cephalic. It's symmetric. Your hair is appropriate color for your age. It looks nice and pretty.
Thank you.
I'm gonna go ahead and look at your head. Scalp is white. I don't note any lesions or masses or any type of deformity. Don't note any dandruff or flaking or parasites. So that's all good things, all right?
Mm-hmm. Great.
So from here, I'm gonna go ahead and test the rest of your head. So do you mind taking your glasses off for me? Okay, I'm gonna be feeling your temporal artery, okay? Okay, it's 2+. I'm gonna move on down to your temporomandibular joint. Now what I want you to do is open real wide, now close, now clench, okay? I do note popping, so crepitus is present in the TMJ. Is that normal for you? Okay, and cranial nerve 5 is intact. So what I want you to do is I want you to smile, not frown, puff up your cheeks, act real surprised. Cranial nerve 7 is intact. I'm going to go ahead and feel your frontal and your maxillary sinuses. Have you had any tenderness recently?
No.
Okay, so I'm just going to feel them. In your maxillary. Okay, and you said no tenderness? Okay, I'm going to move on to your eyes.
All right.
and your external structures appear to be present and intact. Sorry. I'm going to look into your conjunctiva, so I'm just going to pull down your eyes. Okay, it's pink and moist, your sclera is white. So I'm going to test direct and consensual responses. So I'm going to shine this pin light into your eyes, okay? And I just want you to look straight ahead. Ready? Okay, on the other side. All right, direct and consensual response is present. Cranial nerve 3 is intact. I'm going to go ahead and grade your pupils. Pupils are 3 millimeters. They are round and they are symmetric. Your eyes are also symmetric. I'm going to test for accommodation. So what I want you to do is look straight over my shoulder and look at my pin. Okay, now follow my pin to your nose. Okay, cranial nerve 3 is intact. Pupils are equal, round, reactive to light and accommodation. Cranial nerve 3 is intact. So what I want you to do is we're going to keep your head real still, but I want you to follow my pin light with your eyes only, okay? Okay, cranial nerves 3, 4, and 6 are intact. This is just the cardinal gazes. It just tests your extraocular movements, okay? Let's go ahead and move on. Oh, by the way, I don't note any drainage or lesions on your eyes, so let's go ahead and move on to your nose. Have you been having any drainage?
No.
Don't note any redness or lesions, so I'm just going to shine this up in your eye. Your nose looks symmetric, by the way. Intact. I don't note a deviated septum. I'm going to test cranial nerve 1 now, so what I want you to do is close your eyes. Now cover one of your nostrils with your finger. Now I'm going to put something in front of your nose, and I just want you to tell me what you smell, okay?
Alcohol.
Okay, now on the other side.
Alcohol.
Okay, cranial nerve 1 is intact. I'm going to move on to your ears. Have you been having any tenderness?
Mm-hmm.
Okay, so I'm just going to look on the outside. Your external structures appear to be all intact. Don't note any redness or drainage or any excessive earwax.
Okay.
I don't note any lesions or masses. I'm just going to palpate it, okay? On the other side too. Okay, and I'm going to go ahead and look in it with my otoscope. So I'm going to turn it on, and I would pull the ear up and back. Okay, looking into the ear, I know that the tympanic membrane is pearly gray. It is translucent and it is shiny, and the ear canal is intact. I notice that your ears are symmetric on both sides of your head, and they are appropriately placed onto your head. So what I'm going to do is I want you to lean forward straight, and I'm going to be testing cranial nerve 8.
Okay.
So what I want you to do is cover one ear, and I'm going to go whisper something in it. I want you to tell me what I say, okay?
Cranial nerve 8 is intact.
And I would test that bilaterally. I'm going to move on to your mouth. So I'm going to go ahead and put on a pair of gloves. Okay, so what I want you to do is say ah.
Ah.
Okay, uvula is midline. Tonsils are grade 2. Is that normal for you?
Mm-hmm.
I see that your teeth are in good repair. The floor of your mouth is glossy. No, 28 teeth. Your buccal mucosa and your gums are pink and moist. Your tongue is pink and moist. The hard and soft palates are intact and present. And can you stick your tongue out for me? Now moving from side to side. Okay. Cranial nerve 12 is intact. I'm gonna take off my gloves. Now what I want you to do is I just want you to swallow. Okay, that's good. Cranial nerves 9 and 10 are intact. Gag reflex is present. Trachea appears to be midline. I don't note any masses or lesions on the neck. I don't note any pulsation. No JVD is present. Everything appears to be good and symmetric. I'm going to go ahead and feel for your lymph nodes. Okay, so you can sit right here. This is your preauricular. This is your posterior auricular. This is your jugulogastric. Your occipital, your posterior cervical, your superficial cervical, your submental, submandibular, the deep cervical chain, and the supraclavicle. I don't know if I said occipital or not, but it's back here. I would test that bilaterally. None of them are palpable, so that's a good thing. I'm going to go ahead and feel your epitrochlear nodes, and they are not palpable either. Go ahead and listen to your breath sound. Okay, so if you don't mind to just turn a little bit. Okay. Okay, now if you don't mind, you just turn around. We'll listen to the back ones. Okay. Okay, you can go ahead and have a seat. I didn't note any adventist breath sounds. Everything sounded nice and normal. I noticed that your breaths are unlabored. I don't note any pulsation. I don't note any bearing. Your chest is a 2-to-1 ratio. Any abnormalities? There were no adventist breath sounds. When I was doing your front, I didn't notice any tenderness. I didn't notice any masses or lesions. I'm going to go ahead and listen to your heart sounds, okay? Oh, sorry.
Very good. I'm just gonna turn this way a little bit.
All right, so I'm going to start with your aortic heart, your aortic heart sound, and it is on your right side, the second intercostal space on the right of the sternal border. So, okay. I'm moving over to the pulmonic on the second intercostal space left of the sternal border, moving down to the Erb's point, which is the third intercostal space left of the sternal border, moving down to the tricuspid. I apologize.
You're good. Let me help you.
Thank you. It is the third intercostal space left of the sternal border, and I'm going to listen to your apical, which is midclavicular, fifth intercostal space on the left of the sternal, just on the left side. And I'm going to listen to this for a full minute, okay? Heart rate was a 68. The rhythm was nice and it was even. I didn't note any murmurs or abnormalities, and S1 and S2 were noted in all of the heart sounds. Go on and I'm going to listen to your vowel sounds, okay? I'm going to start in your right lower quadrant. I'm going to move up to your right upper quadrant. You're going to move on to your left upper quadrant and your left lower quadrant. Okay, they were all normal, so normal active. You can get back up if you want.
Okay.
They were normal active. If they weren't, or if there was anything wrong with them, I would listen to each quadrant for 5 minutes.